This is Daniel, co-founded Docktari with
Yogo.
Yeah. I was born to two wonderful parents in a very wonderful family, and I had the opportunity to be exposed to, several opportunities which, thank God, I've been able to make use of in one way or the other. I'm fairly educated. I have several diplomas, masters, and currently finishing up my PhD. But the most interesting thing is we really didn't have any background. We don't have any background in medicine, but we have a solid background in problem solving. So we saw a problem and just decided to put our brains together to solve it.
I was born and bred in the southwestern part of Nigeria. After finishing my secondary education in Nigeria, I left for Russia on a scholarship given by the Russian government in conjunction with the Nigerian government. And I'm currently finishing my bachelor's here in Russia.
So what motivated us to come up with such an idea? We have been working on several projects over the years, several things, and we have been looking for ways to basically try to do something for our nations, our countries, our continent. And this amazing idea basically hit us in the head from nowhere. I mean, it's not something we had planned to work on. So it happened that one time I wanted to do a routine medical test and I needed to speak to a cardiologist. But I didn't know which or how to even start finding one, let alone a good one, let alone one I could afford. So I did the thing that all of us do, all of us Africans are very familiar with. I asked my parents, I asked my relatives, do you know a doctor? Of course, everybody points you to the doctor that they know. It could even be a herbalist for all they care. But that's the one they point you to. So they pointed me to a physician, and I went, I saw that physician. I had a full body check, and he referred me to a cardiologist. And all along that line, I'm spending money, I'm having tests that I frankly didn't know whether I needed or not, but were costing me money. And when I ended up meeting the cardiologist, then I had to book an appointment and I had to pay not so small consultation fee. And I met this cardiologist. He was very professional, he was very good, but it took me 3 hours just to get in the room with him. And I thought there could be a better way to solve this issue. So it was in the waiting room of this hospital that the idea came up that there could be a better way to solve this. So I contacted the genius over here. So I quickly sent Diego a message. I'm like, look, I've just got this brilliant idea. Let's do some research and find out if it's being done anywhere in the world. So we found out that, there are telemedicine companies in so many developed countries, and technology is basically disrupting for the better the industry of medicine. So we thought, wow, we could actually get this done. So we did some more research and found out there was nothing as robust and as technologically advanced in Uganda and in many African countries. So we decided why don't we do it? I imagined a future where any of us could just pull out our phones and talk to any medical specialist that we wanted from anywhere in the world, without having to call our grandparents, asking them to call their cousins to find that doctor friend that they have. And I would like to do that at a price that was very friendly to my pockets. Well, that's basically where this idea came from.
After Daniel came to me, we sat down and made some sketches about we even sat down and decided first what solution would be the best to bring to the market. And we decided to come first with an Android app. So we sat down, made some sketches of how the app will look, made some UI designs, the color scheme and things like that, what technologies we were going to implement in the app, things that would be easier, would be better to the African market.
We started 2017. Wow. We started 2017. We published the first working prototype in May of 2018, before the OIC Startup Summit. Wow. Because we had that target of, before we go for that summit, we had to have a semi-working prototype to show. So basically, to solve the issues of healthcare, why did we choose to do it the way we choose? We really believe that healthcare should be affordable. That's the first thing. We believe that everybody should have access to healthcare. I believe they call it universal healthcare, where everybody has equal access, to doctors, to specialists, and at any time. But we also believe that doctors and healthcare specialists should be able to enjoy this profession and financially benefit from it. So it should be affordable, but it should not be so cheap as doctors do not gain from it, because it's a motivation for finances are a motivation for everybody. So we believe that there should be a balance there. Then we also believe that this healthcare should be quality healthcare, and the doctors should be licensed quality professional doctors. And so we try to bring all these factors together: ease of access and authenticated licensed doctors, and then try to encourage the medical professionals on our platform to offer their services at fees and prices that anybody, anywhere in the areas where they serve can afford. So that was the motivation behind our design, behind our implementation, behind every decision that we make. We try as much as we can to bring value to the doctor. We try as much as we can to bring value to the patient, and that in turn brings value to us and to our investors.